It took them 12 years to figure out I had multiple sclerosis. 12 years of miscarriages, 12 years of needless surgery, 12 years of complete, baffling hopelessness.
I have lupus. I also have Sjogren's, Raynaud's, hypothyroidism, so I have a host of other autoimmune diseases.
They took out my duodenum, attached my stomach directly to the intestine, hoping that with that gone, I wouldn't have any further problems with my stomach. But that wasn't so.
About 50 million Americans, or 1 in 5 people in the United States, suffer from autoimmune diseases, a response by the immune system where the body actually attacks its own cells.
We're all familiar with immunity as the way the body responds to invading microorganisms. But sometimes that response goes haywire, and rather than attacking something that's foreign or external, the immune response attacks something in the body, and that's autoimmunity.
Women are more likely to be affected, with autoimmune disease a leading cause of death in women below the age of 65.
This is extraordinary when you think about this. There are many things that cause death in young women. For this to be a major issue is indicative of the fact that we are not diagnosing these diseases quickly enough, we are not treating the patients quickly enough, and by the time we get around to recognizing what the patient has, it's often too late.
With over 100 different types of autoimmune disease, from lupus to multiple sclerosis, a national nonprofit organization called the American Autoimmune Related Diseases Association, or AARDA, is dedicated to bringing a national focus to autoimmunity and working to offer a collective voice.
AARDA is a voluntary national health agency. Its mission is to bring about collaboration in education, awareness, and research around autoimmune disease.
Over the years, AARDA has successfully advocated for legislation establishing the NIH Autoimmune Diseases Coordinating Committee, established the National Coalition of Autoimmune Patient Groups, and provided initial funding for the creation of the first Center for Autoimmune Disease Research at Johns Hopkins University. AARDA is nationally recognized for its research efforts, scientific meetings, and medical publications about the cause of these diseases, which is still a puzzle to the medical profession.
For autoimmune disease to occur, you need both the genetic precursor of the disease, and then you need an environmental trigger of autoimmune disease.
These diseases share a common disease pathway. They share common genetics. Therefore, they're connected as a disease category. And why that's important is they tend to run in families, but not always as the same disease.
Celebrities help spotlight that important message.
I'm here because I want the rest of the people in this country to know that autoimmune diseases constitute a major U.S. health crisis. That autoimmunity is the underlying cause of more than 100 autoimmune diseases and represents more than $100 billion in annual direct healthcare costs.
While much about autoimmune disease is still a mystery, we do know that it is widespread, difficult to diagnose, and runs in families. That means if one family member has lupus, another could have Crohn's, and another Graves' disease. That's why knowing your family's AQ, or autoimmune quotient, is vital. To learn your family AQ, visit AARDA.org.
Hi, I'm Charlie Villanueva. And I'm Austin Day. You know us for our passion for the game of basketball.
But we have more in common than just our love for the game.
I have alopecia areata.
My mom has multiple sclerosis.
These are just 2 of the over 100 autoimmune diseases.
50 million Americans have an autoimmune disease, and they run in families, so everyone needs to learn their family's medical history.
Join us in helping the Autoimmune Disease Association fight back against autoimmune disease. Please visit or call 800-598-4668.
And AARDA's collective approach is helping gain visibility.
So one of its main focus has been to get autoimmune diseases recognized as a disease category so that there'd be more collaboration in research at NIH, more public understanding that the relationship between over 140 diseases is autoimmunity.
Along with a national summit, AARDA promotes scientific meetings and public forums and sponsors and funds an alliance of more than 30 single disease groups which rallied for their cause.
by associating with the entire autoimmune community, we have more leverage and hopefully more impact on Capitol Hill and groups, governmental agencies.
And while there is no cure, with more research, there is hope.
I'm convinced that over the next 10 years, maybe 15 at the outside, we will be able to control the immune system and teach it not to attack the healthy tissues.
Until then, AARDA's efforts to support and advocate for continued research offer a brighter future.
We're beginning to move beyond the stage when we just treat autoimmune disease with anti-inflammatories and immunosuppressive drugs, and we're really getting down to the point where we're looking just at the components of the immune response that are most important in producing the disease.
We need research. That's what we need. We need answers.
That's what's wonderful about AARDA, is that it's a collaboration of all of us groups with the same mission, but working together for the same goal.